Good morning, everyone. It is my pleasure to welcome all of you, to today's panel discussion on the topic of preventing non-communicable disease, in short form NCD, in developing nations. My name is Tarun, son of Vijayan, and I will be your moderator for this session. Non-communicable disease, especially cardiovascular disease, in short form CVDs, have emerged as a significant global health issue. Millions of lives are lost annually due to preventable factors such as an unhealthy lifestyles, air pollution, and limited access to healthcare. This discussion aims to reach into the strategies that can help us address the critical issue. Ladies and gentlemen, our goal today is to provide actionable insights to how we can tackle cardiovascular disease through a multi-pronged approach that includes health, environmental intervention, government policies, and educations. We are also explore how these efforts align with the Sustainable Development Goal, in short form SDG 3, which focuses on ensuring healthy life and promoting well-being for all. Allow me to introduce our esteemed panelists. First, our first lovely and charismatic known person, Dr. Diation from HKL, Nur Lailatul Akmar binti Masrur Nizam.
Okay, hi. And today I'm very excited and can't wait to share more information about cardiovascular health with the other panelists in this forum. So, yeah.
That was wonderful, Dr. Nur. Our second panelist, known as the Wise Thinker, General Director of JAS, Jabatan Alam Sekitar, Professor Izauddin Ashraf bin Daud.
Okay, hi everyone. Good to see you today. And I'm really excited to share information with you guys and all the audience.
It is have been long time, Professor. I'm waiting for our discussion, followed by our third charming panelist, Public Health Advisor in Ministry of Health, Dr. Lee Jensen.
Okay, thank you, Mr. Darut. I'm looking forward to today's discussion, and I'm confident that this forum today will provide valuable insights into the prevention of CVD, which remains the leading cause of death in Malaysia as of 2025. CVD is not new to us. In 2023, CVD was responsible for 15.1% of all deaths in Malaysia, according to the Department of Statistics Malaysia. This highlights the crucial role of the government in implementing effective strategies to reduce the prevalence and impact of CVDs in our country.
Wow, that's a lot of information on cardiovascular disease. I'm looking forward to our discussion, Dr. Lee. Last but not least, our most handsome panelist, Chief Nursing Officer from Hospital Sedang, Muhammad Naufal bin Kamarud Zaman.
Hello everyone. I'm happy to be here to talk a lot about this exciting topic.
Thank you, Chief. Let's give them a warm welcome. Without further ado, let's get right into our first panelist. I would like to invite Dr. Nur Lailatul Akmar binti Masrur Nizam to talk about the topic on a heart healthy diet for cardiovascular disease prevention.
Okay, thank you, Mr. Moderator. Today I want to talk about the evolving relationship between cardiovascular health and diet. Lifestyle modification, particularly dietary changes, are the cornerstone of managing cardiometabolic risk factor. By understanding the different diet and the impact of cardiovascular health, we can make informed choices to support the prevention of cardiovascular disease, both in early stage or after diagnosis. A diet rich in fruits, vegetable, and whole grains offers essential nutrients and antioxidants that play critical role in protecting the heart. Evidence strongly support the benefits of dietary patterns like Mediterranean, DASH, and plant-based diets. These diets has been proven to provide significant cardioprotective effects and are widely endorsed by professional healthcare societies. Meanwhile, emerging dietary trends such as ketogenic diet and intermittent fasting show promise but require further long-term study to fully understand their effects. In recent years, research into the relationship between diet, the gut microbiome, and tailored to understand dietary needs could become a powerful tool in improving cardiometabolic risk factor. However, it is important to acknowledge that adopting a heart-healthy diet is not without its challenges. Barriers like access to fresh, nutritious food and time needed to prepare balanced meals can make this change difficult. Yet, the effort is worth it, as a healthier diet means a healthier heart and a healthier quality life. So let's work together to overcome these challenges and embrace the diets that nourish both our heart and our life. So that's all for this part. Thank you.
Thank you, Dr. Noor. The healthy diet was a wonderful idea. After this, I'm also going to follow it. Next, I would like to invite General Director of JAS, Professor Izauddin Ashraf bin Daud, to talk about on the topic of promoting active and green urban design.
Thank you, and thank you, Mr. Moderator. I have served in this department for almost 20 years, and I was invited here to discuss about preventing cardiovascular disease from environment aspect. So basically, air pollution is one of the leading environment risk factor for cardiovascular disease. According to World Health Organization, WHO, air pollution causes an estimated 4.2 million premature deaths annually, with a significant portion due to cardiovascular disease. Long-term exposure to polluted air can increase the risk of heart attack, stroke, and hypertension. Fine particulate matter and gas like nitrogen dioxide from vehicles and industries directly affect cardiovascular health by causing inflammation and oxidative stress. Reducing air pollution is not just about protecting the environment. It is also a direct investment in our public health. So other than that, urban design also plays a pivotal role in preventing air pollution and promoting cardiovascular health. By integrating green space like parks, trees, and green roofs, city can absorb pollutants and improve our air quality. Additionally, designing walkable neighborhoods with bike lanes and public transport system can reduce the reliance on private vehicles, cutting down the emissions. This also encourages people to adopt healthier, more active lifestyles, which is beneficial for cardiovascular health. So thank you.
Thank you, Prof. Izauddin. It is clear now about urban design. Thirdly, please welcome Public Health Advisor in the Ministry of Health, Dr. Lee Jensen, to talk on the topic of government intervention for cardiovascular prevention.
Okay, thank you, Mr. Tarun. So the government should definitely prioritize implementing policies that support healthy food subsidies and nutrition standards. So how does the government supporting this policy contribute to the prevention of CVD? Healthy food subsidies enhance access to nutritious foods for everyone by making fruits, vegetables, and whole grain more affordable and accessible, especially for low-income families where cost can be a significant barrier for them to access these healthy foods. These subsidies encourage people to opt for healthy options instead of processed and high sugar foods like sugary snacks, sodas, and fast food. A diet rich in nutritious food helps lower blood pressure, reduce cholesterol level, and decrease the risk of obesity, which all of these are a key contributor to CVD. Additionally, implementing nutrition standards in schools, workplace, and public institutions reduce the consumption of unhealthy foods. These standards ensure the availability and promotion of healthy options while limiting the intake of trans fat, added sugars, and sodium. This helps individuals to develop a better eating habits from a young age and maintain them throughout their lives. I also found an article from WHO, which the guideline highlights that subsidies for healthy food like fruits and vegetables can increase their accessibility and affordability. This encourage higher consumption of these nutrition foods, leading to improved dietary habits, which can reduce the CVD. Besides that, an article from the American Heart Association, AHA, emphasized that dietary patterns rich in fiber and low in saturated fats, trans fat, cholesterol, added sugar, and salt are associated with a reduced risk of CVD. Thank you.
Thank you, Dr. Lee. It was an useful information about supporting healthy food subsidies and taxes on unhealthy food. Last but not least, I would like to invite Chief Nursing Officer Muhammad Naufal bin Kamaruzzaman to talk about topic on raising awareness and early detection.
Thank you, Tarun, for the energetic invitation. As we know, CVD is often referred to heart disease is the leading cause of death worldwide. Yet, what's alarming is that most cases are preventable. Prevention begins not in hospitals, but in our homes, schools, and communities by spreading awareness and fostering healthier lifestyles. Understanding cardiovascular disease includes conditions like heart attacks, strokes, and hypertension. While genetics play a role, the primary culprits are preventable factors such as poor diet, lack of exercise, smoking, and stress. So, as one of the community, of course, we have to concern with each other by playing the role to the public, such as spread awareness and educate others about the cardiovascular disease. The question is, why public awareness matters? Imagine if every person understood the risk factors for heart disease and knew how to take proactive steps to mitigate them. Public awareness equips individuals with the knowledge they need to make informed decisions about their health. It empowers communities to adopt healthier habits and reduce the stigma around seeking medical advice or making lifestyle change. So by doing awareness campaigns, people can be educated about the warning signs which often go unnoticed or are ignored. Public awareness initiatives also ensure that underserved communities receive the information, resources they need. These communities often face higher risk due to limited access to healthcare or lack of education about cardiovascular health. By targeting these groups, we can address health disparities and improve outcomes for everyone. Cardiovascular disease doesn't appear overnight. It is the result of years of gradual changes in our body change. But we can detect and address early if we take the right steps Screening and early detection are crucial tools in this fight, allowing us to identify risk factors such as high blood pressure, high cholesterol, diabetes, and even early signs of heart vascular disease before they manifest as life-threatening events. The numbers are clear. Study shows that individuals who undergo regular health screening are more likely to identify risk factors early and take preventive action. But screening is not just about detection. It is about empowerment and giving individuals the knowledge they need to take control of their health. When we know our numbers of blood pressure, cholesterol, and blood sugar, so we are no longer in the dark. We have the information we need to make informed decision to change our habits and to work with healthcare professionals to craft personalized prevention plans. Furthermore, preventive care and early intervention are far less expensive and far more effective. So how can we promote this life-saving practice? It's simple. The first thing is that we must educate ourselves and others about the importance of regular health checkups and the availability of screening programs. The second step, which is screening, should be accessible to everyone, regardless of socioeconomic status. We need to advocate for policies that make preventive healthcare a priority. And the last yet, the most important step is action. Let's encourage one another to act, schedule the checkup, visit the clinic, or attend that health fair. A simple task could be a difference between a health life and a tragic loss. Thank you.
Thank you, Chief Naufal. Raising awareness in public health will be a great way to prevent cardiovascular disease. Now, we open the floor for the question and discussions. To start off, with mounting evidence that air pollution is a significant risk factor for cardiovascular disease, accounting for millions of premature deaths globally, Professor Izauddin, could you elaborate how does air pollution contribute to the rise in cardiovascular disease and what can be done to reduce these environmental risks?
Thank you, Mr. Moderator. That's a very good question, actually. So certainly when we inhale polluted air, fine particles enter the lungs and bloodstreams. These particles can cause inflammation in the arteries, which are a major contributor to heart attack and strokes. Studies have shown a strong correlation between a higher level of air pollution and increased rate of hospitalization for heart-related conditions. That's why addressing air pollution is crucial for both prevention and treatment strategies in cardiovascular care. So, how can we reduce air pollution? So, each party has its own peacock role in dealing with this air pollution issue. So, for communities, they can play a significant role by advocating for clean energy, policies to transition from fossil fuels to renewable energy such as solar. So they can support public transportation and carpooling initiative. Planting trees and creating community green space to help filter air pollutants. By doing this, we can significantly reduce harmful emissions. For the governments, there are some ways to reduce air pollution by promoting active and green urban design. First of all, government can invest in public transportation infrastructure to reduce car dependency and implement a implement policy that mandate green building design and urban greenery. Offer incentive for adopting clean energy technology and plan city with walkability and bike friendly infrastructure as prioritized. This action collectively reduce air pollution while fostering healthier and more livable environment to communities. Lastly, what can we do as an individual to help reducing air pollution? So here's some ways that we can do. We can using public transport or carpooling, switching to energy efficient appliances and renewable energy sources. We can support local green initiatives such as tree planting campaigns. We can also reducing energy consumption at home to lower emissions from power generation. So it is about making small but consistent change in our daily life to create a collective impact. So thank you.
Thank you, Prof. Now I understand some science facts that have been proved to be causing cardiovascular disease. And I hope people helps to reduce air pollution based on the ways that you mentioned before. Next, Dr. Noor, given that many cardiovascular diseases are preventable through lifestyle changes and early detection, what specific strategy can healthcare providers do?
Okay, thank you, Mr. Moderator, for the question. So I will giving an advice about the regular physical activity. To maintain optimal cardiovascular health, adults are encouraged to engage in 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity each week. Even a small increases in physical activity levels can lead a meaningful reduction in cardiovascular risk. The good news is that for inactive adult without known cardiovascular disease, there's no need to consult a physician before gradually increasing physical activity to moderate level. This makes starting an active life more accessible and less intimidating. Studies consistently show that as activity levels increase, the risk of cardiovascular disease decrease. For example, a study involving over 9,000 men and women aged 15 and older found a clear association between higher levels of physical activity and reduced cardiovascular risk. A systematic review of 33 studies further confirmed the benefits of regular exercise, highlighting its impact in lowering the risk of coronary heart disease. Whether you choose brisk walking, cycling, swimming, or dancing, the important thing is to find the activity that you enjoy and stick with it. Physical activity isn't just about the minutes you spend to moving. It's about the investing your heart, your health, and your future. So let's get moving and keep our hearts strong. Thank you.
Thank you, Dr. Noor. After this, I have decided to jogging every day, and I hope people do regular physical activities as well to prevent cardiovascular disease. Dr. Lee, could you share what key policies should government prioritize to reduce the high mortality rates caused by cardiovascular disease, especially in addressing preventable risk factors?
Thank you, Mr. Tarun. That's an interesting question. So in my opinion, the key policy that the government should implement is to impose taxes on tobacco, alcohol, and sugar drinks. But first, let me discuss how tobacco contribute in CVD. Smoking introduces harmful chemicals into your body that damage both your blood vessel and heart. which can ultimately result in CVD. Moving on to alcohol, excessive consumption can also negatively affect heart health. It raises blood pressure and weakens the heart muscle over time and can significantly contribute to the development of CVD. Finally, sugary drinks are packed with calories that contribute to a weight gain, which a major risk factor for heart disease. This makes sugary beverages another serious concern when it comes to protecting CVD health. So back to our question from Mr. Tarun just now. How does taxation affect the prevalence of CVD? Increasing tobacco taxes raises the cost of cigarettes, discouraging people, particularly young individuals with lower income, from starting to smoke. It also motivates current smokers to quit or reduce consumption. A prime example is Australia, where tobacco taxes are among the highest globally with 65% of taxes. This policy has been highly effective as the rate of daily smokers aged 15 and above has dropped from over 24% in 1991 to just over 11% in 2019, according to The Guardian. This significant decline shows how effective taxation has been in reducing smoking rates, which help lower the risk of CVD. Similarly, increased taxes on alcohol reduce its affordability, particularly for heavy drinkers and younger consumers. Lower alcohol consumption mitigates the cardiovascular risk associated with excessive drinking. Taxes on sugar drinks are another impactful measure. Higher price makes these beverages less accessible, encouraging people to reduce sugar intake. As a result, individuals often switch to healthier alternatives like water or unsweetened drinks, which are better for cardiovascular health. So finally, I found two articles from WHO that supports this point. The first from December 23, WHO talks about how increasing taxes on alcohol and sugary drinks can help prevent CVD. The second from the WHO results report 2022 shows that more countries are using health tax and laws to improve public health. These articles highlight how taxation can reduce the use of harmful products and encourage a healthier choice, which helps lower the risk of CVD. Thank you.
Thank you, Dr. Lee. It is good to know that government prioritizes policies, especially in taxation on tobacco and sugar drinks. Lastly, Chief Naufal, what role does health education play in reducing the risk factor for cardiovascular disease, and how can we improve health literacy to empower individuals to make healthier lifestyle choices?
So, health education is critical in mitigating the risk factors for cardiovascular disease, CVDs. It serves as a proactive approach by promoting behavior change. So, what is the strategies to improve health literacy and empower individuals? First of all is to simplify health information by using clear, concise, and jargon-free language. Leverage visual aids like infographics and video to convey complex information effectively. Next is to utilize apps, websites, and social media platforms to disseminate information widely and interactively. Lastly is community engagement, doing partnership with schools, workplaces, and community organizations to integrate health education into daily environments. Train community health workers to deliver culturally appropriate education. Thank you.
Thank you, Chief Naufal. I hope everyone to take notes on what you have said. And now, we have reached our end of this panel discussion. Thank you to our panelists for their insightful contribution and for their active participation. This discussion has shed light on the importance of collaborative efforts in addressing cardiovascular disease. By implementing these strategies, we can significantly reduce the global burden of cardiovascular disease and improve overall public health. Together, let's work towards achieving the goals of SDG 3, which focuses on ensuring healthy life and promoting well-being for all. Thank you and have a great day ahead.